So you've been diagnosed with breast cancer. Remember that in 2012, the chances of curing your cancer are excellent. You have at least a 90% chance of being cured, if not higher. The treatments are very well tolerated and will include surgery, may include chemotherapy and radiation and anti-hormone therapy. Now for surgery, your doctor may offer you a partial mastectomy, which means removing part of your cancer, part of your breast with the cancer inside. And remember that partial mastectomy means the same thing as a lumpectomy and a segmental mastectomy. Now some patients ask for their whole breast to be removed. There's no need to remove the whole breast because removing the whole breast is exactly the same as removing part of your breast in terms of survival. Now in some cases, if your doctor recommends removing your breast, he's doing that because the cancer may be bigger or there may be multiple cancers, but for the same cancer size, the chances of survival are exactly the same. Now if you have partial mastectomy, you must have radiation because it's only with radiation that the two operations are equivalent. Now after your surgery, your doctor, once he or she looks at the pathology results, will offer you chemotherapy depending on the results. They will also offer you anti-hormone therapy if your cancer has hormone receptors. What that means is that your cancer has receptors, it likes hormones to grow. So if you give anti-hormone therapy, you're actually helping to control the disease. Now some patients may get chemotherapy before surgery, and if you're one of those patients, don't worry, that's perfectly fine. In 2012, we sometimes give the chemotherapy before surgery because we want to personalize the treatment to make sure that we're giving the right chemotherapy. So you've heard that breast cancer has a chance of happening in women 1 in 9. Well, let me explain that to you. The 1 in 9 refers to women who are in their 80s because the chances of breast cancer increase with age. So really, breast cancer is very rare in women in their 30s and 40s. We tend to remember those women because they're our friends, they have young children, it affects us. But in terms of their chances of having breast cancer, very small. The chances of cancer increase with age like any cancer, and in fact when you reach the age of 88, that's when you reach that 1 in 9, 1 in 8 chance. So that's why as you get older you have to be closely monitored for breast cancer, and when you're younger, of course you have to be aware of your breasts, but the chances are not as high.